I knew the very moment I heard you typing that your mic was on, and I therefore offer you the floor. You can take your full 20 minutes to give us your views. The floor is yours, Dr. Cole.
Okay. Thank you. We both work at Royal Holloway, but I also have a role at RUSI, which is the Royal United Services Institute, which is a defence and security think tank. So I'm going to focus specifically, I think, on some of those security issues that have really come up during COVID-19. So if we go to the next slide, I was going to go through some of the background on COVID-19 and the emerging technologies, and particularly how technology has been able to help us understand the background of the disease. And then looking at typical defence and security approaches and the role of defence and security in civil emergencies, both from UK examples and from India. Chris has already gone over some of the potential security issues arising, and I'll give a couple of other case studies, and then the future considerations really is part of it that Chris has already covered. So if we go to the next slide. One of the things I'm sure you're all aware is that the COVID-19 outbreak, as far as we're aware, began in China. The first cases were recorded in China in December. And the Chinese government alerted the World Health Organization to that late in December. And really from that moment on, the cases as they spread across the world were being tracked in real time. And that data has not only been tracked by epidemiological organizations and Centers for Disease Control, for instance, World Health Organization, it's been tracked by individuals as well, by universities, by crowdsourced maps. And so the picture I have up is the map that's been created by Johns Hopkins University in the US, and they have literally been adding cases in real time as they're picked up by governments and countries across the world. And people have been able to follow that. And so we've been able to see the spread, see how close cases are to us in the early days, which countries they were in. And that's been a huge advantage in particularly for policymakers deciding at what point they make policy decisions, at what point they were able to close down, because there was a very good understanding of not only where cases were in the world, but how close they were to you at a very granular level. But from a security point of view, an interesting thing with that is that there were already a couple of fake versions of that Johns Hopkins map that have malware embedded in them that are tricking people when they search on Google for Johns Hopkins map. They direct them to a false site, and it's being used by cyber hackers. So there is both an advantage and a disadvantage to this technology being available. And one thing we have to be very aware of is making sure that members of the public who haven't necessarily engaged with digital technology to the extent that we may be asking them to now are aware of some of those pitfalls. So that do people know how to search safely for the information they're looking for? Do they know how to distinguish one site from another and to know which is the real one? And this is something we don't necessarily train the general public in as well as we should, particularly those who perhaps don't use computers during their jobs, but who may have access to the internet through smartphones or through laptops at home. The other diagram on here is the number of cases by country across the world. And again, what that's allowed us to show is how quickly diseases are spreading within countries. And the names of the countries aren't actually on those colours of the lines, but if you can see the yellow and light blue line towards the bottom are China and Singapore. Just above those, there is a cluster of lines quite close together, which are largely the European countries. And then you have the green line, which is spreading very fast, which is the US. And what's interesting with that is you not only see it by country, but you see that by continent, there tends to be similar spreads in continents. So in Southeast Asia, there tends to be relatively slow spread. In Europe, there tends to be consistent spread within European countries. And then there is this much bigger spike in the US. And we don't necessarily know exactly what the reasons for that are yet. But it's something that can help scientists to look at perhaps what are the reasons behind that data. One of the feeling is that perhaps climate has an impact. So the warmer and slightly wetter climates in Southeast Asia may actually be preventing spread. Certainly in US, I think one of the big impacts on that very steep spread is because it's New York, which is very, very densely populated. It has a subway system on which most people travel. It has very dense, very high-rise buildings. So it can help us to start to understand what might be the reasons behind that data as well as the data itself. If we go to the next slide. this is also showing how quickly data has been able to be mobilized in this outbreak. So the sequence of the first strains of COVID-19, of the SARS-CoV virus that were picked up in China, the full genomic sequence of those done within 2 weeks, which if you think back to even 10 years ago when there was a swine flu outbreak, being able to create a whole genome sequence that quickly would have been almost impossible. It's through Next Strain, which is maintained by a laboratory in the US. Scientists across the world are sequencing the strains from within their own countries and have been able to upload those in real time and create a complete phylogenetic tree of the different strains that are circulating. And we now know that there are a couple of different strains circulating which are of different, some of them are more infectious and more deadly than others, which may help with creating a version for a vaccine. We know to some extent where those strains have come from. So for instance, we know that some of the strains in Italy from the ski resort helped it to spread around the world. They haven't come necessarily directly from China. They've come through other routes, which may help us in the future to understand how disease is spread. Again, scientists around the world have been able to pull data on the actual structure of the virus itself, which are the very squiggly diagrams under the Royal Holloway logo. And an interesting one as well is data that we have from weather patterns and meteorological data and satellite images have been able to show where pockets of very poor air pollution are. And we know that air pollution seems to be having an effect on how the virus is spread. So you can see in the area of North Italy, where there was the first large European outbreak, it's particularly a poor area of air pollution. But also what we've seen is once lockdown happened and there started to be a lot less transport and a lot more petrol fumes, actually that level of air pollution drops. It's still relatively poor compared to the other areas of Italy and Europe around it. But we see very quick from the data, we can see impacts having a very quick impact on what's happening. So if we go to the next slide. So next slide, please. Yeah, so if we look at this in terms of security and defense and cybersecurity, the military and militaries across the world have obviously been becoming increasingly interested in cybersecurity over the last really 20 years. And their approach to cybersecurity tends to be very threat focused. So it tends to be looking at hostile actors who would normally be considered hostile actors. So countries such as Russia and China from the West's point of view, who have traditionally been hostile nations. Is this a new weapon that they use against old enemies? And we've seen, for instance, there's been a lot of concern over Russian interference in elections, both in the US and in the UK, Russian spreads of misinformation. And so the military is very good and very well set up at looking and identifying and countering misinformation from Russia. That's something we've also seen in COVID-19. There have been some examples, and I'll give some later on, of Russian cyber hackers spreading misinformation, not necessarily infiltrating other organizations' systems, but just putting out fake news stories, fake narratives that might undermine how other countries are approaching the outbreak. So if we go to the next slide. And one of the issues that comes in with this idea of hostile states is the ownership of infrastructure. Particularly in the UK, there's been a lot of concern that a lot of communications infrastructure and the digital infrastructure that we use to communicate, we use to collect and share the kinds of data we've spoken about, are owned by Chinese companies. So Huawei in particular, who are rolling out the 5G network in the UK, and who also largely are responsible for the communications on the London Underground. And a defence and security concern is to what extent can you actually control your communications infrastructure if it's owned not only by foreign nations, but also foreign nations who have traditionally perhaps been hostile towards you? And is that going to affect how you can respond during events such as this? There is no suggestion really, because the pandemic is a natural event, there is no suggestion that China would want to have any kind of hostile action during that. But there have been concerns perhaps about whether China wants to control the narrative and some of perhaps the more, I'd say more critical responses to China's response, particularly in the early days when there was very strong lockdown, There were stories of people their windows being welded shut in buildings so they couldn't leave their buildings, of people falling dead in the streets, and there were kind of social media stories coming out from people who proposed to be in China. If those were being removed, was that Chinese censorship, or was it actually because that information couldn't be verified and no one was sure if it was true or not? So these kind of add into some of the security concerns around that. And I know from colleagues I'm working with on another Indian project, they've been asked now not to use Zoom and not to have meetings over Zoom because, again, Zoom is Chinese owned, and there is some concern over, do you really want the Chinese listening in to some of the meetings and some of the planning perhaps that you're doing around this? And certainly a lot of social media platforms such as Reddit that Chris and I work with quite a lot, and again we'll talk about later, and TikTok, which is used very much by children and young people in the UK. Is there likely to be some kind of Chinese influence on the messages about COVID-19 that are going out over those? So if we go to the next slide. But one thing obviously that digital technology does offer us is it offers us a lot of opportunities as well as threats. It's really one of the things that's become very apparent in the COVID outbreak is that for a lot of industries and for a lot of people, it is very easy to work from home, but for others it's much more difficult. And there has been a lot of concern both in the UK and the US about the groups that seem to be being hit more hard by COVID-19 tend to be poorer socioeconomic groups. Now, we know on the one hand that in general their health tends to be poorer, so perhaps they are less well to start with, and so they're less able to fight off the disease. But also lower socioeconomic groups tend to be working in the type of group of occupations that are still being asked to work. So for instance, low-paid healthcare workers, supermarket staff, delivery drivers, taxi drivers. And so they are not only going out to work and coming into contact with other people much more often, quite often they also travel to work on public transport, on crowded buses and crowded trains, because again, being lower economic status and poorer, they don't own their own car. So we're seeing the opportunities that enable some of the wealthier people to feel that they are protected from this, and in some ways are protected. Those protections are not there for the poorer members of society. And as it was mentioned about the tracking phones, if we look at trace and track and these tracking apps as a way to open up the economy, does that actually disadvantage the people and also the communities where those phones are less common? So if you have an area where everybody is able to trace their contacts, perhaps that area could open up, shops could start to open, cafes and restaurants could start to open. But in poorer areas where there's less coverage and less ability to use that track and tracing data, do those areas have to stay in lockdown for longer? And I think one of the things that COVID-19 is doing is it's really highlighting some of the inequalities within society and the unfairness of those inequalities that haven't really been laid bare in quite the way that they're being laid bare by this pandemic. It's also making us aware that again, things like having online consultations with doctors, being able to order our groceries online, being able to communicate with our families online, are very, very dependent on having access to this technology. Some years ago, there was a study in the UK that showed that children who have their own tablet at the age of 7, again, whose parents can afford it, whose parents are tech savvy enough to help them to use it, already had an educational advantage over other 7-year-old children who didn't have their own tablet. And as that's been followed through, that educational gap has widened as those children have got older. So something as simple as having technology available at a very young age can actually influence your education going forward. And there is a lot of concern in the UK at the moment about whether the lockdown would have disadvantaged poorer children whose parents are less able to give them access to the online learning resources, who are less able to guide them through those online resources, than wealthier children whose parents are more able to help them through this. If we go to the next slide. So again, looking at the role of the military, one of the things that the military have been able to do in the UK is to certainly look at that misinformation and the cyber hacking. There's been a very good relationship between the military intelligence officers and military cybersecurity officers and the private sector in the UK for a while, and that's been being built up over the last 10 years. The UK military works very closely with UK industries that are thought to be likely to be at risk from hostile nations, as particularly China and Russia, and to help them to protect their systems, to help them to identify potential attacks on their systems, and also to be able to coordinate attacks on systems within the private sector that may not automatically get picked up by government, so that you can start to see trends. If there are 4 or 5 different banks that are seeing the same type of attack, 4 or 5 different supermarkets seeing the same type of attack, you can also use that information to warn other supermarkets and banks that haven't picked up that attack yet, that perhaps they're at risk. And so this information gathering and intelligence is something the military are very good at. And they also tend to be much better at it than civilian agencies. So certainly during the current COVID-19 outbreak in the UK, that is a role that the military is contributing to very strongly, is to helping to shore up that civilian cybersecurity. The other thing that the military can do is they can erect temporary communications infrastructure. So perhaps in remote areas where villages may not be as connected as urban centres tend to be, they can go out and set up that kind of infrastructure very quickly. So again, if you're looking at online messaging, online teaching, at online communication with healthcare professionals, there may be a role for the military in setting up some of the infrastructure that makes that possible. If we go to the next slide. One thing we wanted to talk about, and particularly because it's somewhere that Chris and I are particularly interested, is with fake news. Fake news is always quite a big issue. It's always, I think the traditional media in particular like to blame social media for fake news. I would say that traditional media can be just as bad. But what tends to happen with fake news is that the motivations for fake news don't tend to be specific to the event. What tends to happen is that certainly special interest groups and conspiracy theorists that push fake news generally will orient that fake news that they want to push out to the current situation. So for instance, some examples of things we've seen in the UK is when the UK Prime Minister Boris Johnson was diagnosed with having COVID-19, his symptoms were reasonably mild, but he was taken into hospital largely as a precaution. There started to be fake news being put around that he was on a ventilator and that his condition was critical and that he was likely to die. That was actually a fake narrative that was put out by Russian cyber hackers. That was picked up very quickly and it was able to be countered. But it was very important to be able to get the message out very quickly that this is fake news, so that there isn't concern as to how will the country be able to deal with this if our Prime Minister dies. Another fake narrative that we picked up is that the vaccine trials that have been carried out by Oxford University, there was a fake news story being put out that one of the volunteers who'd volunteered to be tested with the vaccine had died because of side effects of the vaccine. That again was a fake narrative put out by the anti-vaccination lobby who want to undermine vaccine efforts. They want to show that vaccines are not the answer to this. Again, that was very quickly countered. The volunteer who was being reported to have died was able to be contacted and was able to tell everybody that she was fine. There was a big issue in the early days when Chris and I were moderating on Reddit with YouTube videos that were being uploaded by people who are claiming to be citizens in Wuhan, that it was very difficult to verify if they were or not. If somebody posts an image of riots in the streets, of people falling dead in the streets, of police brutality, is that actually what's happening outside their window, or is it from a movie? Is it from a riot that took place last year? And it can be very difficult to verify that. One of the things that we did on Reddit is that a couple of the moderators on Reddit who spoke Chinese, if anybody uploaded one of those videos, they would immediately send them a message in Chinese and see if they could respond to it. If they could respond to it in Chinese, at least you knew that they were a resident in China, or they were genuinely a Chinese citizen, rather than, for instance, an American who may have very anti-Chinese sentiments, who was trying to undermine China and essentially use the outbreak as an excuse to attack China. I want to come particularly to the picture of the chickens at the bottom, because one of my current research projects in India is with the poultry industry. And you may have seen there's been quite a lot of fake news around the poultry industry in India, which is actually pretty much, it's hit the poultry industry's profits very badly, and certainly has hit poultry farmers very badly. if we go to the next slide, I'll give a bit more detail on that. I noticed about a year to 18 months ago at the conferences that we were attending in India that the poultry industry itself was putting out some narratives about eating chicken and eating poultry that I felt were not entirely accurate and were not entirely honest. There is quite a kickback against the poultry industry in India, both from Hindus who see meat eating as not part of their religion, and also from animal welfare groups who are concerned about animal welfare. And the poultry industry is very keen to put out its own view against these narratives, but the narratives the poultry industry puts out are not always entirely honest. And for instance, one of the narratives that I thought was, I had concerns about the way the poultry industry was countering, is that saying the animal welfare groups and the Hindu groups both said that eating chicken brings down the age at which a girl has her first period. And this was a reason not to eat chicken. You don't want younger and younger girls to be having their periods. The poultry industry countered this by basically saying that's not true, that's fake news, that's conspiracy. But the fact is it actually is true. If you have higher protein in your diets, you do tend to have your first period at a younger age. And girls in Europe and America do tend to have their periods at a younger age than India would. At an average age in the UK would be somewhere around 11 or 12. In India, where there's less meat in the diet, it tends to be around 13 or 14. Now, in actual fact, my feeling is it doesn't really matter whether a girl has her first period at 11 or 12, or whether she has it at 13 or 14, as long as she's having them before she wants to have children, and that's likely to be a long time after her 13th or 14th birthday. It doesn't really matter. So that the poultry industry should actually have been countering to say, well, yes, it does, but this isn't necessarily an issue, and in general, higher protein might help to counter malnutrition and poor nutrition. And so look at the positives, but don't deny the negatives that other people are bringing up. And around this time as well, there were also stories were circulating around avian influenza and it being a risk to humans, which again, it's true that it is. Avian influenza can occasionally jump from chickens to humans. And so again, rather than saying this isn't true, it's better to kind of engage those narratives and to explain what's happening. Because the poultry industry didn't do this, I think it actually left itself very open and very vulnerable to some of the fake news that has been circulating about chickens and coronavirus. Again, it was largely the groups who were attacking the poultry industry in general, jumped on those, I would say, the weaknesses of the poultry industry and used it to push stories that chickens were spreading coronavirus. And in a way, because it's been difficult to disprove some of the other things that the poultry industry has said because they haven't been entirely truthful, it was very difficult to make people believe that chickens don't spread coronavirus. And so I think that's really a lesson to look at the way narratives are perhaps being directed at your organisation and actually look at what is the underlying basis of truth in those narratives and make sure that you're challenging that, not challenging them with equally biased views of your own that are equally wrong. Because if you do that, you lose the trust of your consumer base. And I think that's what largely has happened with the poultry industry in India, is it didn't really have much trust amongst the consumers. And so therefore it's been very hard for the consumers to trust anything else they say. So if we go to the next slide. Chris talked very much about surveillance and public health and contact tracing. The green document that I put up there, and I can send a link through to that, is a report and a project that I was involved with Chatham House with their global security programme about 3 years ago, which was looking at the benefits of sharing data and public health surveillance and basically weighing up some of those issues around the rights of the individual to their privacy and to not be followed and to not have somebody logging their movements against the rights of a community to be protected against infectious disease that is spreading amongst it. And there tend to be, again, very vocal privacy lobbyists who are very concerned about the government following them and tracking them and are concerned that the government is kind of spying on them all the time. But I think the vast majority of people are less worried than that very vocal minority gives the impression of. You know, as Chris mentioned, their phones can track us all the time. They generally know where they are. Our credit card says what we've been buying in supermarkets. If the government really wants to track us and know exactly where we are and what we're doing, it already has lots of different ways of doing that. And to add the health data onto that doesn't really make much of a difference. And I think we do have to weigh those rights of the community against the privacy concerns of the individual, perhaps in a way that we've never had to quite that ethical extent before. But my feeling is with public surveillance, and it always has been, is that public surveillance is a tool of the government. And actually what you need to do is trust your government. And if you don't trust your government to use that technology responsibly, you need to change the government, not blame the technology for it. And so I think this is a time for governments to also think about how do they win the trust of the public in making sure that that level of surveillance is necessary and is proportionate to the situation in hand. And one thing I would mention is that with some work we'd done before, one of the things we looked at quite early on in social media's rise was how did countries approach social media compared to how they approach freedom of the press and also freedom of speech of their citizens? And were they treating social media in the same way, or was it slightly misaligned from what you would expect? And the two places where we actually saw a unusual alignment that we wouldn't have expected in the way social media was trained. One was in the Middle East, where governments just didn't really seem to have noticed or to take seriously the extent to which people were communicating over social media. And interesting, it was just before the Arab Spring. And we had kind of thought if we were what were quite repressive governments in the Middle East who tended to want to control their citizens quite closely, it seemed potentially a vulnerability in their control of their citizens that they were allowing them to have this much freedom over social media. And so it was interesting then to see the role that social media played in the Arab Spring. And the other place we saw the misalignment was India. And that was interesting from the other direction, because India, which was a democratic country, seemed to be controlling certainly the monitoring of social media and phone communication. And for instance, keeping records of who had mobile phones and exactly a mobile phone number to a greater extent than you would expect to see in other countries with a similar level of democracy. And what seemed to be behind this was some of the concerns about the way that the terrorists in the Mumbai bombings in the Taj Mahal had communicated over social media, that they had communicated with each other, they'd planned over social media, and they'd also, I think, detonated one of the bombs using a mobile phone. And because of that, the Indian public seemed to understand that this level of government control over their communication was necessary and proportionate. And so we're less concerned about some of the privacy issues than we'd seen in other democratic countries. So it can not only be around the political ecology of the country as a time, but it can actually be tied to the political ecology at the time that technology is introduced. So that technology being introduced in India at a very specific time where a very specific event happened actually had quite a big influence on the Indian policy around privacy and security. So if we go to the next slide. And so we mentioned contact tracing, and I think this is, for the UK, this is really an issue where some of those privacy concerns are being tested in a way that the government hasn't really had to test them in real time before. We know that contact tracing has a huge impact. We've seen that the countries that instigated contact tracing quickly, particularly Singapore and Germany, seem to be the ones that have managed to keep their cases very low. And the UK is currently testing contact tracing in the UK on a voluntary basis. It's saying that you can download this app to your phone if you want to. It's not forcing people to. Depending on how well that goes, it would be an ethical consideration as to if it was felt that the number of people who weren't downloading was hampering the ability of that technology to actually keep the epidemic under control. At what point might the government have to consider making it compulsory? A good story I heard once is that the reason the government or the UK government had to make wearing seatbelts compulsory is because people were too stupid to wear them if they didn't. And I think that's actually, it's something that applies to this. It's not only yourself that you're harming by objecting to this privacy, it's other people. And to what extent do you have right to your own privacy if that also gives you the right to let other people be harmed? And so I think these are they're quite nuanced ethical considerations that really need to be played out in the context of this pandemic. If we go to the next slide. I think Chris mentioned machine learning and AI and some of the opportunities for that. There certainly have already started to be a lot of studies, particularly on the value of being able to go to such a granular level with the data so quickly. So not only can we identify which areas might be at risk in terms of, we've mentioned things like where there are areas that are densely populated, where their public transport tends to be quite crowded, where air pollution is bad, but we might actually be able to identify the individuals within that population and perhaps the buildings within that population that are super spreader, either super spreader individuals or super spreader environments. And I'm involved in a couple of projects at Royal Holloway looking at air pollution, and particularly whether, for instance, certain high-rise buildings perhaps exacerbate spread, and also do people with certain respiratory conditions, are they more or less likely to spread the disease than other people? So we can go down to that very granular level. And we can also use machine learning to perhaps quickly identify how likely certain people pass infection on to others. And this could be used to create vulnerability indexes that allow very precise targeting of interventions, particularly if those interventions are limited. So if we cannot test everybody within a city, how do we decide on the 2% who we need to test first and who should be prioritised for testing? And this might also be able to help predicting lockdown exits. Again, one thing we're interested in the air pollution projects is where there are what we're calling pockets of vulnerability. If you have a city where RO across the whole city is below 0, but actually RO in a couple of high-rise buildings may be above 1, if you don't particularly tackle the spread in those buildings, that could create a super spreader event that pushes RO above 1 for the rest of the city again. So we can use that very precise ability to dig down into very large data sets from machine learning and AI to identify some of these pockets of risk within much wider areas and data sets. If we go to the next slide. I think this is into Chris's, so I'll really leave it there. I think that's Chris has gone into detail of that. But I think what all of this shows is that we're living in a very interesting time. We're living in a time where we are more digitally connected, we are more digitally enabled, there is more technology than we have ever had before. This is the first pandemic that has been played out in the digital world to this extent, even going back to the swine flu epidemic. We didn't have most of the social media platforms we use now. We didn't have quite so much penetration of then. But I think that does bring some challenges with it. It brings the challenges of cyber hacking. It uses the challenges of misinformation and fake news. It brings the challenges of how to make sure we don't leave behind people who don't have that technology available to them in quite the same way. And I think certainly we will be continuing to collect data, to analyse data, and to use data to help us fight this pandemic as we go forward. Thank you.
Theoretical study, and the theoretical study convinced me that there was far too much intellectual effort on modeling and on very weak assumptions, and much too little emphasis on technology. And so we did little bits of work in some contact with some people in Cambridge, Nicky and her group in Cambridge, on automatic contact tracing. So what's contact tracing? Well, it's the most effective intervention in reducing the spread of a disease. Essentially, when someone is diagnosed as having the disease, or if they test positive, it's important to identify and isolate the people that they may have infected, their infectious contacts, before those people in turn have time to infect anyone else. So one is effectively chasing the disease and running faster than the disease. Oh, if we go to the next slide, please. Can we go to the next slide? The slide we were just on. That's great. So the speed two things matter here. Speed, well, three things: accuracy and scale. I'm going to talk about speed in the next slide, but actually first I'm going to talk about scale, because traditionally contact tracing has been done by people. When somebody is diagnosed as ill, they're visited by people whose job it is to trace their contacts, medically trained people who talk to them, find out who they may have infected over the last few days, and then contact those people and try to persuade them to self-isolate or get tested and so on. This does not scale up well. This is highly effective for small outbreaks. It's really difficult to apply if there are many transmission chains in the community. So the promise is that our new technologies can help this. So many current projects, and the UK is going to roll out a project, an app using the technology uses is mobile phones with Bluetooth Low Energy. Bluetooth is a communication protocol. Bluetooth Low Energy is designed for tasks like connecting your headphones to your phone without using a wire. So it's supposed to work on distances of up to about 2 meters. It will connect on distances up to about 5 meters. And Google and Apple have already moved fast to change the operating systems of Android and iOS so that your phone can be open to connections by Bluetooth Low Energy without giving away its identity. That is, it gets a series of identities which change quite rapidly, many times a day. So you can't be tracked doing it. You can leave your Bluetooth on. And the idea of information that's used to identify contacts is the only method of doing it is by the phone-to-phone contact using Bluetooth. So the phones essentially go through the first stage of setting up a Bluetooth connection, and they record this, and they will frequently try to do this, so each phone will record a sequence of Bluetooth contacts throughout the day. This is in principle quite easy to program. Of course, there are many issues, such as identifying how far away another phone is, which is not necessarily very accurate. And you make decisions about how to balance your battery usage against the rate at which you're attempting to contact other phones. What I think is likely to, but it's really simple to implement this as a first generation system. And these systems, I think nobody had developed such a system before the pandemic because it seemed fictional. Back then, we were unable to imagine the situation we're in now, and now such a system looks as if it might be pretty useful. Now, I believe that these first generation systems, they may be useful, but they have some drawbacks. The main problem may well be that a Bluetooth contact between two phones is unfortunately not the same as an infectious contact between two people. So there are likely to be a lot of false positives. It will connect, Bluetooth connects outside, it'll connect some distance away, it'll connect through internal partition walls. So two people can be sitting in two separate offices, their chairs on either side of a wall, and according to Bluetooth, they may be in close contact for the whole afternoon, but in fact there's been no infectious contact at all. Now, false positives in a contact tracing system are really expensive. That is, you're warning people that they're expensive for a number of reasons. Let's go through it. And false positives are not good. First of all, if you warn people that they may have had an infectious contact, they've got to go away and get tested. This is expensive, inconvenient. You might ask them to self-isolate until they get their test results as a precaution. That's expensive and inconvenient. And if it's well known that most of the people warned in this way are not really infectious contacts, then people won't have a great deal of faith and they may not obey the instructions. The compliance may be quite low. As anyone who tries to connect devices using Bluetooth knows, then false negatives are also quite likely, particularly in noisy environments. A really difficult problem actually here is that in interpreting it. So if you simply imagine a list of your Bluetooth contacts during the day, it may be very difficult to go from this list to deciding which ones are really infectious contacts. The system may need considerably more information on the place, on what you're doing on the activity, and what kind of contact it is. So did this contact occur indoors or outdoors or in a vehicle? If you're indoors, were you in the same room? And what was the size of the room? Was it a small, poorly ventilated room? What were you doing? Were you speaking? Was it an elevator? Were you coughing? Was there any talking? And what is the accurate distance between you? There is another very important type of infectious contact which Bluetooth can't give you at all. And that is what happens if you're in the same place but at a slightly later time. So if an infected person sits down in a cafe with a plastic tabletop and leaves their viruses all over the tablecloth, and you come down and you're the next person to sit in that seat, Bluetooth cannot tell you that because you never were close to him, but you put your hands on the table and you pick up viruses. So we need really accurate co-localization over slightly different times. Oh, can we have the next slide? Can we have the next slide, please? I hope you can you all hear me? Ah, great, thank you. So let's just look at what makes contact tracing effective. So the upper arrows, so labeled A and B. So person A catches the disease, then they, for a period of time, going from left to right across the screen, they are incubating it, and then they get to the point where they're infectious. And then after a while, we hope that they get diagnosed, and a little bit after they get diagnosed, their contacts are traced. Now, is this useful in stopping the spread of the disease? Well, in the top two arrows, it is. Because when person A is diagnosed, person B is still incubating. They're not infectious yet. So if person B can be traced while they're still incubating, that's great. You can ask them to isolate themselves, or you can start testing them and then identify as soon as they become infectious, and you can really break the train of transmission. You can stop person B infecting anyone else. So this is easy if you have, so the strong contact tracing, you like to have a long incubation period, early diagnosis and testing. So you want to diagnose as soon after person A becomes infectious as possible, and rapid tracing. Well, a slightly less good timeline is shown below in the bottom half of the slide with weak contact tracing. So if we have a short incubation period before becoming infectious, and then a person is diagnosed rather later, and then there's another delay before the contact is traced, well, we've only traced person B after they've already been infectious for a considerable time. And so the contact tracing is much less effective because now we've got to contact trace for person B, and person B may have infected C, D, and E, and so on. So the lesson from this simple diagram is that effective contact tracing needs to have an integrated system of comprehensive, early, fast, and repeated testing. So the testing needs to be comprehensive. We're catching lots of people with the disease. The testing needs to happen early so that it's then worthwhile to trace the contacts. The testing needs to be fast, so you shouldn't have to wait for your test results. And the testing needs to be repeated because one test may not be enough. You may only test positive once you stop shedding virus. Then you want to accurately identify contacts, and then you need rapid contacting, follow-up, and repeated testing of the contacts. So contact tracing isn't just a technology on mobile phones. It needs to be combined with a whole health delivery strategy of comprehensive testing, rapid testing, and follow-up. A recent paper in Science, which some of you may have seen, by Ferretti et al. From Oxford, they do some calculations, some elaborate calculations, which effectively put in rather complex equations, what I've put in these diagrams here. Theirs are far more than this. And they come up with an estimate that if 60% of the population carry a mobile phone contact tracing app, then this could have a major effect on COVID-19. Well, I think you can say that they are theorists, because they might be right, but you want to have the correct 60% of the population loading these apps onto their phones, because you want to contact trace the people who are going to be spreading the diseases. And so you want the right people to put the apps on their phones. It matters which 60% of people. So you want to have the spreaders with the apps on their phones, and not just the victims. So could I have the next slide, please? Could I have the, thank you very much. So we wrote several papers on this. I'm going to talk about one of them. Now, as I said, just a sequence of Bluetooth contacts through the day may not be easy to interpret. There might be a lot of false positives and false negatives. And what we realized, or Huang Nguyen and I realized, was that mobile phones have a lot of sensors in them, and the accelerometer, for example, in a mobile phone can record hundreds of values per second. It's extremely cheap to use for battery life. The mobile phone clock is pretty good, so we get a well time calibrated trace. And it also, certainly in Android, has very few permissions associated with it. So a great many apps can record from the accelerometer without asking much permission from the user. So the graph on the left shows 3 people sharing a ride in the same taxi. Each of them is carrying a mobile phone. They're sitting in the same vehicle. And this was a 9-minute taxi ride. This research was really more of a pilot study. We didn't have any funding, so I think the graduate students may have paid for their own taxi. So the ride was not very long. And the previous slide, please. So what this slide is telling you is that by using a mobile phone sensor that tells you something about the environment, and if that environment changes, and it changes in the same way for people in the same place, in this case a taxi, then you can correlate these sequences, and within a relatively short time, you can tell from these recorded correlations, if the 2 phones have these correlations, that the people were in the same vehicle. That's an important special case. If you go to the right, the top right graph, this is the same as the blue graph from previously, but then the person got out of the taxi and they started walking for a little bit. So the mobile phone sensors can also tell you something about what the person is doing. Are they sitting still? Are they walking? And so on. And in this case, you can see that walking is very different from sitting in a taxi. The third one is a nice one. In this case, we have two people in a car following one person sitting in a bus. So the car is following the bus. And we can see that actually, if you're traveling along the same road, you get very similar sequences of bumps and accelerations, and these can be correlated too. So certainly, I'm just remarking here that these sensors can give you a lot of information about place. We haven't pursued this line of work, but certainly one possibility would be collecting many accelerometer traces from phones going along roads all over a city. And we believe that it would be possible to identify the road that a phone is going down from the accelerometer trace alone within a few minutes of accelerometer trace. So this is just from one instrument. Our phones also have many others. Could we have the next slide? Modern smartphones may have up to 18 different sensors in them. They have accelerometers, gyroscopes, temperature, ambient light, magnetometers, barometers for atmospheric pressure, all capable of rapid time sequences of readings. In this case, we looked at the problem of seeing if people are traveling in the same carriage on a train on the subway. Now, here, these are traces from the magnetometers from different mobile phones of people sitting in the same carriage on the subway, and you can see that there are detectable similarities in the time series. So magnetometers, for example, can be informative where there are large electric currents, as on trains and possibly in some streets and buildings.
Okay, I think my problem's fixed.
Oh, right, cool.
Okay.
I've got one more slide. This is working really well.
Okay, thanks.
Okay, so could I have the next slide? Great. So I'm going to suggest that from contact trace that the automatic contact tracing with mobile phones is potentially a very powerful technology because of its scale and speed for controlling disease. That it's one of the technologies that we know is going to work to a certain extent, that we can use to get us out of lockdown and able to walk around. But the second generation contact tracing is going to have, I'm suggesting that we're going to need to use multiple phone sensors for co-localization, particularly indoors, to see if people are in the same room. Sound, for example, an exchange of sounds between phones. As sound will only travel through air, it will not travel through partition walls, and the time of flight gives accurate distance even in a cluttered environment, and you can also tell the size of the room. Identify the place and the activity, and of course delayed co-localization whether you're sitting at the same table in a cafe. These technological possibilities are not occurring in isolation at all. There is much other commercial pressure for indoor localization and activity recognition. We've just been writing a review on this, and we think there are up to 30,000 papers since 2009 dealing with various methods of localization. The consequence is that I suspect there is a strong and perhaps irresistible pressure for universal and contact activity tracking, or at least the capability to switch it on if needed. And as I was saying earlier, I think it's likely that you may need to get to have strong pressure to require a large fraction of the population to have this on their phones. It's potentially a privacy nightmare, because your phone, the next slide please, your phone will know where you are, who you're with, and what you're doing. Now, it doesn't get more personal than that. But it could have a very tangible benefit in enabling us to move around freely and to rapidly eliminate new infection chains. I'll ask, could there be a stratification of society into those with the tracking phones and those who don't have them, some separation between them? The last remark I want to make is one which I feel is really obvious, but is not very well appreciated. Your phone feels like a friend in your pocket. It's many people with their smartphones, it's the thing they stroke the last thing at night and the first thing in the morning. It feels like your friend. It's not, it's a false friend. Your smartphone runs programs written by other people that essentially want to take your money in for certain services. So for example, your phone, I'd be very surprised if there isn't a small startup company figuring out how to tell when people are drunk by using the accelerometers and gyroscopes from their phones, and then advertising them things accordingly. So there has long been pressure to install software on phones for commercial reasons, to tell where you are and what you're doing, and provide advertisements or indeed discriminative pricing. And these commercial pressures and the technologies, some of the technologies developed for these, are rather similar to technologies developed, which may be developed for contact tracing. So I suspect that both the contact tracing and commercial applications of place and activity recognition are going to become connected and reinforce each other. And so that's the present contact tracing applications which are being rolled out are in some ways a little bit similar to undergraduate projects. There are much more sophisticated activity recognition systems which have been underdeveloped by many people, which are likely to be in second generation contact tracing systems. So that's what I have to say.
Well, thank you very much, Professor Chris Watkins, for that wonderful exposition on the the help that technology can render, and also the perils of technology, because this is obviously something that reminds us that Big Brother can watch us more closely, and governments can really stage a comeback, and how, with this kind of technology. So, but the thing that strikes me is that there is an assumption here that everybody is carrying a smartphone, and that may be true in developed economies in the West. But then the pandemic is not just something that afflicts developed countries. It's now a global pandemic, and there are vast swathes of the global population where smartphones are a huge luxury, and you may simply not have enough of smartphones to make this kind of technology work. There are also issues to do with simply the relay towers and signals and stuff like that, which may restrict the flow of data in a timely manner. So I'm just wondering, these are things that you might reflect on when we come back to you in the Q&A session. I now, before I turn to the questions here and relay them to the two speakers, I just wanted to put in a couple of questions myself. One is about the role of fake news. Since you have algorithms and various applications that can do a fair bit of contact tracing on social media, is it possible in the current context to identify exactly the source and origin of fake news, and then put a label on it, whether it's a state or non-state actor. In other words, that you go back all the way through the fake news, through the kind of relaying that may have been done to get to source. The second one is that day far when people will actually have to have IDs and proper passports, verification procedures of the kind that you need to get onto an airplane or to withdraw money from your bank, in order to actually use online platforms on which so much depends today, so much is at stake. And yet we live in a world where it's the easiest thing to create all kinds of bots and, you know, fake accounts and Facebook accounts and all sorts of things. So when will that hanky-panky in the online space stop, and what kind of global consensus is required for that? The third thing would be, is that day far when we can look for a specific, you know, USA Patriot Act kind of provision, legislation that was in the context of 2001 and terrorism. But since you are speaking of the balance between individual privacy and rights and the requirements of security, can we have something specific for COVID-19? And what would that context be? Something resembling the Patriot Act. Now, I will quickly run through the questions here, very many. We have, for instance, Dr. Samuel Cherian, who's actually acting as the webmaster. He's masquerading as Mr. Piyush Singh this afternoon. And that's the fake part at our end. He addresses his question to Professor Watkins. Are there differing permissions for the various sensors in the phone? And which is the sensor with the least problematic permissions amongst all the sensors you mentioned that could be used as an alternative to Bluetooth and GPS? Or are the privacy issues the same irrespective of the sensor used? Next is Mr. Munish Sharma, who works on technology issues at our institute. It's a question for Dr. Watkins. Are we going to witness more intrusive surveillance programs after the pandemic? What is the likelihood of people willing to trade privacy with safety against coronavirus-like contagious diseases? Diya Deep Singh of our institute, common question to either of you or the both of you. Is there any correlation between fake news and fake narratives and the dark web users? Shruti Pandalai from our institute for Dr. Cole. You spoke of the threat perception of hostile states and ownership of infrastructure. Could digital autocracies become more durable and entrenched now? Brigadier Ashish Chibbar, currently with our institute, he's a serving army officer who's working on cyber issues and AI and things of the sort. He wishes to know whether it's safe for MNCs to provide contact tracing apps, or should these only be provided by governments, as in sourced from governments? Also, should this data be stored within the country or outside? Next is Abhi Ghosh, wishes to know how successful has been the trial of contact tracing in the UK on feature phones. Has it been tried? We have Group Captain Atul Pant, who wishes to know, well, I don't have his question here, sorry. We have Wing Commander Ajay Lele of our institute, who works on these issues. I haven't seen his question here, so I'm sorry. These are the ones I had tried to, I think these are briefly the questions. Yes, please go ahead. Yeah, Samuel Cherian's question was, is the virus man-made, and what's the role of China?
Okay, I'd love to talk about whether the virus is man-made, what's the role of China, but I would talk about it from the point of view of common sense, but that's quite a long answer, so I'm not going to talk about that now. The first, I think Abhi Ghosh had a question, how successful is the UK trial? Well, the UK has been slow in a lot of things, and it's slow in starting its trial. It starts in 2 weeks' time on the Isle of Wight, which is a small island off the south coast of the UK, and they'll see how it works there. So we don't know yet. I don't think anybody has got the Bluetooth contact tracing running yet, but there are projects in the EU, at Mila in Montreal in Canada, and I'm sure there are many other projects also in the US to do this. And there are discussions on international protocols for how to do it. The next question is on Munish Sharma. How will we get more intrusive surveillance afterwards? And this is connected with who does the contact tracing, and where should the data be stored? The answer is yes, we're likely to have more intrusive surveillance because we always seem to have more intrusive surveillance, but I'm not an expert on that. But I don't see that there is a need for things to be more intrusive, because the contact tracing data is only relevant for a maximum of 2 weeks. So as long as it gets deleted, it will only live for 2 weeks. Now, I think one of the major problems with intrusion with data is that this data gets kept. So my mobile phone location data from the mobile phone companies in England, I believe it gets kept for years. I see no good reason why, except the police may sometimes want it. Supermarkets, if I buy something in a supermarket, they keep the data. They want to use it. I think they should delete it. Data gets kept because it's cheap to store and people don't delete it, and it's very hard to verify that it has really been deleted. This bears on the question of who should do the contact tracing. I think the first thing to remark is that it's desirable from a security point of view, as much as possible, for the data to be kept locally on phones, unless it needs to be analyzed, and for analysis to be pairwise, between pairs of phones, rather than over a whole network of phones, a whole network of contacts. So the network contact analysis may be necessary. My personal feeling, I had exactly this discussion with a mobile phone researcher at Cambridge last week, and we kind of looked at each other on Skype, and we said, who do we trust? We thought, do we trust the hospitals and the health service to do this? Well, yes, we would trust them, except they would be hacked because they're not experienced. Do we trust governments? And we just said no. Do I trust Google? Well, maybe, but the point is Google already knows so much about me that knowing a bit more, I don't feel it makes that much difference. And I feel that at least Google is able to protect the information competently. And I would hope to get some guarantees, or at least some promises, that they would delete it and they wouldn't give it to governments. But that's very hard to arrange. So I think these are real and difficult problems. The question about from Samuel Cherian on Bluetooth permissions. Yes, all these different, the system on Android is that each sensor has a different set of default permissions. So if you download an app to your phone and it wants to gain information from these sensors, if it, for example, it wants to listen to your microphone, it has to ask you first. And you have to see this and you have to say yes. But other sensors, indeed the point of our paper on the magnetometer and the accelerometer, was that those sensors were not thought to be sensitive. People thought, well, what personal information can you get from the magnetometer? And the answer is, maybe you can get location information. So this is a potential, so the point of our paper was that there was a potential security leakage. If one person with their GPS on was, you could see if you can install an app on somebody's phone, which records data from these sensors with much lower levels, where lower levels of permission are required, then nevertheless, it can give away your location and whether you're next to someone else. So are people going to be prepared to give up privacy? I think I am not an expert in this area, but I feel that whenever there is any short-term gain from giving up privacy, you give it up. You'll allow people to store things about you that you don't know about. If there is a long-term danger that some government, there could be some political change, and all this information could suddenly be used for some terrible oppressive tyranny, well, people don't worry about that because that's far away. And so what people look at are the short-term gains. But what I really worry about is what I would call the regulatory capture by organizations that want to make money out of data. I think the real problem is that people, say the phone companies, store location data for every phone, and then they sell it to third-party organizations. And they make us some, I don't know how much money, but it can't be that much money in terms of their operations, but they make some money by selling the data to advertising companies who are assessing the effects of street advertising. Now, this data is personal. Your mobile phone trail for a day reveals where you live, where you work, and where you play. That's enough to identify you, even if it's anonymous. And so a lot of data is gathered, and then a lot of data is kept because it's easy to store and nobody is forcing people to delete it. And in my opinion, that is the problem. There is much less problem with keeping data about your from your mobile phone for 2 weeks during an epidemic. And I think people would put up with that. The other problem with contact tracing is, unfortunately, like so many things in health, contact tracing mostly helps other people. So if you're, I mean, it helps all of us together. But of course, if you're going to use my phone to trace the people who have been in contact with me, it's not helping me directly. Of course, it could be helping the other people, so I might get a timely warning. But the personal direct benefit is not quite so clear. So people might not be generous enough to do it. But I think there have been a lot of predictions about whether people would accept lockdown. And I think the predictions before all this happened was that they would not, but it seems that they do. So many predictions have been wrong. I think that's answered quite a number of the questions.
Thank you. Thank you very much. May I now turn to Dr. Cole, please?
Yeah, I'll take some of the others. The question about the fake news and the dark web. There's inevitably going to be a crossover of people who do dishonest things are going to be doing some of those in dishonest spaces. So we certainly do know that people who do nefarious things on the web in general tend to frequent the dark web, and you can trace stories back through them. One of the problems with fake news, particularly for attributing perhaps state involvement in fake news, is that the states will be doing it from state-sponsored computers and state-sponsored accounts. They will be paying people without any trail beyond that to be doing it, from their bedrooms without any trace back to government. But there are obviously ways that your military intelligence officers will have, just as much as the UK's do, of being able to trace some of those back. I think it is an issue, particularly where you say about the threat perception and hostile states becoming entrenched in communications infrastructure of countries. I think it is a real issue. It's something the UK has been very concerned about, particularly around the Chinese ownership. That really comes down to the extent to which a country is able to provide that technology itself. If it is genuine, the UK has been genuinely worried about this and genuinely worried about it for more than 10 years. But at the same time, the UK government hasn't done anything to build up communications technologies companies within the UK who could provide that technology otherwise. The reason Huawei won the contract on the underground was that they were the only technology company who were capable of delivering the solution that was needed. So if there is real government concern about foreign ownership and foreign investment in infrastructure, I think it's up to the government to build up its own industries to be able to counter that. And, and that's something I think actually India has a huge advantage with the Make in India campaign that President Modi has always supported, to make sure that a lot of technology that is used in India is made in India, even if the company is perhaps owned internationally. It's much easier to know exactly what technology is in a mobile phone if that mobile phone was made in a factory in India than it is if it was made in a factory elsewhere and imported into India. So I think India actually has quite an advantage over some of the countries of the world in that, to that extent. I mentioned earlier mobile phones, because it's quite difficult to own a mobile phone in India and to operate your mobile phone in India because there are stricter restrictions on that than the rest of the world. I actually have an Indian mobile phone that I use when I'm in India. That's actually an Indian brand. It's a Micromax phone. So that's not only put money into the Indian economy. You know, I've bought an Indian phone that's been made by Indian workers. The money goes to India rather than it going to China or South Korea when I'm in India. That also gives India a lot more control over the technology that's in that phone that some other countries may have, or that India itself has over perhaps Samsung phones or Apple phones. So I think that's actually quite important at a government level, of to what extent do the government want to build in its own safeguards against that foreign investment. You mentioned as well, which comes into that, the MNCs and owning the data. Again, I think that comes back to that same issue. And that comes back, as I said, to an issue of to what extent do you trust your government? It's quite interesting in the UK. The UK identification, the closest the UK has to a national identification scheme, which is essentially the national insurance scheme that registers everybody with the NHS, but also is used to determine what tax you pay to the UK government. It was actually started during the Second World War as essentially the identification scheme citizens during the Second World War, and at the end of the Second World War was handed over to the National Health Service. So although it is now seen as a health identification system, it didn't actually start as that. It started as a national ID scheme. And that could, in a situation such as this, but be opened up again as, again, a national ID scheme in a time of health emergency. As Chris mentioned, with some concerns around the security of the NHS systems, because traditionally they're not a security organisation, they're not a military organisation. They perhaps haven't been as concerned about being able to securitise their data as other organisations have. But I think, and the NHS obviously within the UK is a very trusted institution. Most people would probably trust the NHS as an institution maybe more than they would trust the government. It's interesting in Germany that it's actually written into the German constitution that the German government are not allowed to own health data on its citizens. It has to be owned by private companies. And that's a legacy of the Second World War and the Nazi government. Because they've the citizens of Germany have seen the absolute worst that can be done by an inherently evil government who have access to people's health data and then can pick out the ill and the weak and exterminate them on that basis. They are making absolutely sure that is never something can be controlled at government level again, which again, it's very specific to their country and to their political past. So to me, it would come back to, it's not really an issue of the technology, it's the issue of your trust in the people who own the technology. And if you trust your government to store that data, then it's fine for the government to store it. If you don't trust the government, perhaps it's better for an MNC to store it. If you trust the MNC, they can store it. If you don't trust them not. MNCs tend to be private companies, they tend to be driven more by profit. That may make them more inclined to keep their customer base than a government. I can't think of a particular private company that have prospered by having an insane dictator at their head, which unfortunately is the case for some countries. So I think that comes down to a level of trust, and that also would lead me on to some of the issues around fake news that you talked about. Is it safe in a way for the internet, and that's, as you called it, a hanky-panky that goes on over less controlled communication channels? The internet was really started, it was started by students who had very perhaps idealistic and naive ideas about freedom of speech, and this being a space and technology that was free for everybody to use. Not everybody in the world is like that, unfortunately. There are good guys and there are bad guys, and all of them want to use this technology. There's a lot of talk in privacy policy issues in the UK around about 10 years ago that kind of petered out a bit as to whether eventually there would be channels to the internet, and there would be kind of more trusted channels and less trusted channels. Largely to some extent, as you get with TV in the UK, the BBC is a much more trusted TV channel than some of the more commercial satellite channels, and that would it come that to have a website, to have a reliable website on the trusted channel, you would have to have some kind of verification for this, and then there would also be other channels where anything would go. My feeling is that hasn't happened, largely because the actual websites themselves have some of that trust built in. So you know there are sites such as Amazon where you can be sure that your money won't be stolen. If you order something through Amazon, you will either get what you ordered or you will get your money back. Similarly, PayPal is very trusted for financial transactions. But some of that does depend on the understanding and the training of the public. Most parents would be more restrictive as to what they would let their children view on a tablet than what they will view themselves. You know, my children have electronic devices, but they have parental controls on them. There are certain sites they're allowed to visit and others they aren't. They have TikTok accounts, for instance. They're not allowed Facebook accounts. So I think that does come down to individual understanding. And again, Stephen Fry, who's best known for being a UK actor, interestingly, he did a very good article on cybersecurity some time ago, which is quite often quoted, which said that he really equated the internet as being like a city, and that how and the extent to which you know how to navigate your way around that city depends on your familiarity with it. So if you've grown up in Delhi and you've been born in Delhi and you've lived in Delhi all your life, you know what parts of Delhi are safe to walk down, you know what parts aren't safe, you know where it's safe to walk at night, you know where it's safe to walk alone, you know the areas you wouldn't go into, you know the areas where you might be quite happy to walk along looking at your mobile phone, but there are other areas where you might be worried about that mobile phone being stolen if it was on display. Some of the problem with the internet, and at the time that Stephen Fry was writing this article, which I think is probably about 20 years ago now, is that adults were less familiar with the internet than children were. The internet was not a city we'd grown up in. Whereas I think now, to more extent, it is. It's not somewhere unfamiliar that we're visiting. It's not like getting off a plane into a city you've never been to before. We know how to navigate that city and the safety of that city a bit more. And I think perhaps one of the things that COVID-19 has done is it has brought more people into that city, into parts of that city they don't normally visit. So people who don't routinely order their groceries online may have been starting to order their groceries online more. People who would meet face-to-face are having more interactions online. And that have we scaled up people's understanding of the safety of those spaces at the same rate that we've been expecting them to use them more. So I think rather than the actual kind of thinking of terms of the dark web and the fake news and the dangerous places of the internet, think about how we provide safety to them. And that may be through guides, it may be trust markers, it may be separate channels, it may be knowing that government websites are more likely to have accurate information than posts.
Sorry to interrupt you at this stage. There's one more question, a straggler. Kapil Patil from the RIS. How can government make itself more, or how can governments make themselves more transparent about the use of private data? How important is transparency and trust building? So perhaps you might want to address this as well. By the way, when we speak of government or governments, we tend to assume that it's a monolithic single government. In many countries, including in India, you have a federal system and you have one government at the center. You have several, opposition parties ruling states. Health in India is a state subject, but national security is kind of more in the domain of a shared subject, though law and order, strictly speaking, and policing is a state subject. And so it's very much the case that you may have one government at the center, speaking of data and advocacy of privacy and limits to personal freedom and all that. And then you have an opposition party actually in charge of both health and law and order at the local level. So it can get very complicated. But anyway, a penny for your thoughts there on that last question. And anything else that you still have left unaddressed, please.
I mean, I think on the terms of government making them more transparent, I think to some extent I would go back to my idea of to what extent do you trust the government, and whether that's the state government or the national government. If you trust the government, do you need them to be that transparent? And certainly one thing that's been raised in the UK is that that citizens should be able to access the personal data that government hold on them, and at least see what is being held by government, and to perhaps request if some of that is removed. So again, I think it's the transparency, perhaps transparency of the process and the trust building, but it comes down ultimately to your trust in government itself. On that kind of difference between the national and the local level, I think one thing, and again is quite interesting with COVID-19, is that the UK have a Conservative Party Prime Minister, but in London, where Chris and I are based, the Mayor of London is Labour, so he is from the opposition party. I think they've both been very, I would say, grown up, as you would hope, and sensible. There hasn't been any political tension around the response to COVID-19 in London between them. And I think that shows a maturity and a strength of leadership, that this is not the time to be picking political fights with one another. And if it is if decisions that are being made around things such as lockdown and easing lockdown, if they are the right decisions, then politicians from opposing parties will agree. There are obviously going to be issues within that of exactly how you do it, and perhaps, for instance, the extent to which the trade unions might have a say in that, which the Labour Mayor may feel the trade unions have more of a say, the Conservative Mayor may think the private sector has more of a say. But actually, to some extent, you can work around those and you can negotiate together. And I think this is a time when that strength of leadership comes to the fore. Are these people who want to be politicians for the sake of the people who they are representing, or do they want to do it for their own ego? And actually, if they want to do it for the sake of the people they're representing, they will find a way to work together through this crisis. And I think that's a way, perhaps, again, to perhaps judge some of your politicians. How are they responding to this? Are they responding to this as a servant of the people, or as somebody who is stroking their ego? And I think we can look at world leaders around the world at the moment and probably pick at the ones that we think are doing well and less well with that, but I'm not going to mention any particular names. And so to me, this is about trust. I think there is a huge issue here about trust, because some of the uncertainty around this means that governments and government leaders are asking people to trust them in a way that they haven't really had to rely on that trust before. And in the UK, I think perhaps certainly since the Second World War, we haven't really had leaders who have had to say, trust me on this. And I think that will, again, it will be interesting to see how the politics of this played out, and how that trust in governments perhaps helped again, if we would go back to the graph I gave on the number of cases in each country, I think you could, to some extent, you could almost correlate those number of cases to where the majority of the citizens trust their government to make the right decision or not. And if you have the leader of your country who is really coming out with some, let's say, perhaps foolish proclamations, it's how do you know what to trust and what not to trust? Whereas if your leader is generally, what they're coming out with seems to be mostly sensible, it's much easier to trust what they're asking you to do. And I think that will have quite a big impact, certainly as we go forward in exit lockdown, on how smooth that transition out of this period is.
Thank you very much, Dr. Cole, and I'm sure all our participants will agree that it's been a very, very interesting webinar that we've had with the two of you, and that both of you have given us a lot of information, plenty of food for thought, and we've had a number of interesting questions that were also answered very ably by the both of you. So it brings us to the very end of what's been a very, very interesting afternoon and a morning start for you in the UK. And I thank both the eminent speakers for their absolutely magisterial presentations, which have added value to the discourse and the research underway at the Indian end as well. And I hope this is not going to be the one and only time that we discuss these issues. Certainly don't want it to be a one-off event. Let's have a continuous dialogue in the weeks and months ahead. And in the meantime, I wish you both the very best of health in London, and a very good day to you. Thank you all very much. Thank you for coming and joining us here. Thank you.
Thank you.
Thank you very much. Thank you for inviting me.
Good day. Thank you.
Bye. Bye.
Bye.
Bye.